All right, so we're going to talk about NG tubes today. The indications for NG tube are small bowel obstruction, ileus, short-term medication administration, and gastric lavage. Contraindications would include esophageal varices, stricture, facial fractures, and basilar skull fractures. The supplies you'll need, of course, you'll need an NG tube. You'll need to get a separate connector for the large lumen. You'll need to get the anti-reflux valve for the smaller lumen. You'll need a securement device, lubricating jelly. You'll also need to have your suction all set up, your I would recommend a Chuck's pad or a towel to place on the patient, because once you put this in and it's in the stomach, you're going to start getting gastric contents. And also maybe a basin, a gray basin would be a good idea as well. The larger lumen here is for suction. So this is the side you're going to set up to suction. And then this smaller lumen with the anti-reflux valve, purpose is to allow atmospheric air to be drawn into the stomach and equalize the vacuum pressure. So that way the end of your NG tube doesn't adhere to the side of the stomach lining due to the vacuum pressure. So now that we have all of our supplies, our suction set up, and we're ready to go, and we've educated our patient, we're going to first measure, and you measure your tubing from the nose to the tip of the ear to the xiphoid process, and then you're going to mark it. You will have the patient sitting up in an upright position, and you'll have their chin to their chest. Excuse our mannequin, he can't bend. You'll have your cup of water ready and pretty much all your supplies open and ready. You'll lubricate your tip, and you will, of course, he will have chin to chest, and you'll start to insert. You might feel a little resistance. If you do, just twist or rotate the tubing as you advance, and you'll get past that oral nasopharyngeal spot. Once you do, and you're in the back of the throat, you'll ask the patient, you'll take the water and ask them to swallow. Every time they swallow, you're going to advance. So swallow, 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 until you get to your marked area right here. You're going to secure it. I would have this end of your tubing laying in the basin as you're inserting, so that way if you do start getting gastric contents, it goes into your basin on their chest. And then you already have your suction set up. You're going to connect it to this connector here. Typically the order is for low intermittent suction, but always check your order. And that is NG tube insertion.